If you have or know of someone with high blood pressure, get your pressure taken and keep a log of that pressure. It's that simple. And then if it's a problem, talk to your doctor about it. I know it sounds simple. If you have these new symptoms I discussed, go to your doctor and check it again, even if you didn't have those a few months ago. Another thing, so how many do any of you have questions briefly about that introduction or what it is to be a hypertensive person? Yes.
Do you have a question about if there are different symptoms in some populations than others? For example, over adults to younger?
There are. Most of those symptoms are determined by a lot of the, I guess, elasticity or the resilience of the individual. Healthier, younger individuals mask symptoms better sometimes, right? Because they're strong and they don't notice. They can walk around with the pneumonia, for example, longer than they're tougher, right? So they can be ignored sometimes. The older population can oftentimes, they have less resilience. So they have, they can crash and burn a little more quickly. But hypertensive all by itself, it's usually about the process of changing your heart muscle and your vessels over time that give you the symptoms. So the symptoms is not hypertensive directly. It's usually a cardiomyopathy or heart pump problem because you had so many years of undiagnosed hypertension. That's more common. So the symptoms you see are really heart pump problems. They're vascular. Their origin was vessel first. So it just depends on your story. But yes, I think the biggest thing with symptoms is unusual fatigue. I mean, your heart gets oxygen and blood to your body. So if you're unusually fatigued and it just doesn't feel like you are you go get your vital signs checked. They're called vital signs for a reason. Get them checked. Older folks, just because we have more insufficient vessels, oftentimes have swelling of our feet, right? And that can be a relative benign, normal situation. It could be very much a significant sign of your pump not doing real well. And early disease symptoms are functionally and possibly nearly reversible. Now, the disease isn't reversible, the symptom is, and we'll talk about that. A lot of people have problems with high blood pressure that are young. Before we went on this campaign that cardiac disease is the number one killer in America, and it's the number one killer of women in America. We used to think it is a men's disease. It is not. So it is anyone's disease. It's very equal opportunity. African Americans have a different risk factor with kidney and blood pressure issues than Caucasians or Northern Europeans. Everybody is different genetically. So we have to be sensitive with what drug we pick. Your doctor has to know these things. Otherwise, you may not be controlled. So blood pressure is a tricky issue. I want you to be managed well, get diagnosed early, listen to those symptoms. But in young folks, as I was saying, one of the biggest problems is they take a medicine, their blood pressure is normal. This happens to old folks too. I don't need it, my pressure is normal. Well, it's normal because you're taking the medicine. And that seems very, very basic, but it's our natural instinct to think that we've cured things. Cardiac disease and vessel disease is a management disease. It's like diabetes. If you're a diabetic, you're a diabetic, period. If you were diagnosed and you met the parameters, you're a diabetic. Even if you control your blood sugar with diet alone, you're still a diabetic. You have to own it. If you don't own it and make it part of your identity and correct it, you will have a symptom from it. So denial doesn't help. But heart disease is very easy to deny until you have functional deficit. And functional deficit, some of that damage is irreversible. We can manage the symptom, but you have a modified vascular system very often by the time you're symptomatic. So I have a lot to say, maybe about nothing, but I think it's about something that's relevant. So, I really don't mind your questions at all. So if you have a question specifically about, I have CHF, or I'm not sure what that means, or I have congestive heart failure and I take a water pill. Why do I take a water pill? What is the risk of a water pill? Great, ask me. But yes.
I have a question. Could you explain what a heart murmur is? And
Sure.
if that's dangerous?
Yeah, and I didn't mention that. I mentioned it under physiology of heart problems in a broad sense. But that's the pump, and the pump has valves. And the valves, depending on where you're at in the heart, make sounds when the blood passes, when they open and close. And like any valve or gate, our heart sounds are the opening and closing, the lub and the dub of the heart sounds, right? And each valve has a different location, has a different sound. That's a doctor's job. But a murmur, there's different types. If I have a door that doesn't, or a valve that doesn't close all the way, and I have blood flow through it, I hear a little, like a door in the wind. You hear a little whistle through it. It's not closed well. That could be one type of sound or murmur. Another type could be that the door, so it doesn't close properly. Another could be it's a little floppy. They have different flow control if there's a murmur. Different types of murmurs sound different depending on what valves indicated in the disease. You have 4 chambers to your heart. So the bottom part is the ventricle that gets all muscular. That's the part, but that's muscular. The ventricle, or the atrium, the top part, doesn't have that thick muscle that changes with high blood pressure. It's like a balloon. It fills up, and then there's valves separating it from the pump part. It goes through those valves into the pump part that squeezes. So we have 4 chambers, right? And 2 sides of the heart. And I will draw a picture next time or have one to show you that because it's very relevant. So valves in general control the flow between those chambers.
So the murmur comes from, one of those valves is
Leaky.
Leaking, okay.
Yeah.
So is it treated surgically or is it?
That depends. Many people have a benign murmur. It's a sound that is made that doesn't cause disease. Other people have murmurs that are a symptom of disease, or sometimes a structural defect, congenitally or otherwise. And other times you can have a damage to a valve for many reasons. One could be you have a little heart attack, and there's little muscles that help those valves, and one of those little muscles can die, so it doesn't close well. If you have long-standing high blood pressure and strain to those valves, which again control the rate and flow between chambers, that's what their job is. So a door that has a little whistle through it congenitally and doesn't really manage to interrupt flow may be benign. One that is larger, that doesn't allow the squeezing of blood without leaking out the wrong way, that could give you a symptom. The blood's going the wrong way. It's regurgitating, and that's what they call it. It goes the wrong way. In that case, we have medicines to help that. Usually it's not surgical. But in older folks, we have a valve called the aortic valve, which I think most of you heard of. It's one of the outflows to the heart, and that one gets calcified real normally in older folks. The more hypertensive you are, the more irritated those vessels get, and you can get calcium deposits. They even have scoring now called calcium scoring to check your vessels for these calcium deposits because it's a sign of inflammation. Another test we'll talk about next time. So these valves can be replaced. There are many, many elderly folks, 70s, 80s, sometimes even close to 90s now, that get aortic valve replacements because it's so calcified, and it's called aortic stenosis. That's when it doesn't open up all the way because the door's rigid with that calcium deposit. So valves can be rigid, they can be floppy, they can be insufficient, and it makes a weird sound.